everybody. Welcome to Aesthetify India's podcast series. I'm Gunjan, your host for today and co-founder Aesthetify India. Today we are diving into a very crucial topic in aesthetics practice and probably the most hardest to crack: managing patients' expectations. Here, the key question is, how do you align patients' desire to realistic goals, but at the same time you want to achieve the great results which satisfies the needs of your patients? And I'm thrilled to have with me Dr. Latika Arya, a renowned dermatologist. Dr. Latika Arya has counseled countless number of patients. She has witnessed varieties of expectations. So what we are going to do today is we'll draw clues from your practice, ma'am, your extensive experience, and we'll try to make this podcast as valuable for our audience as possible. So welcome, Dr. Latika.
Thank you, Gunjan. Thank you so much for your invite. And I'm very happy to be in your podcast because I think there is a lot of misinformation, myths about aesthetic procedures. And, people don't know whom to trust and where to get the right information. So, your initiative is really helping the consumers, our patients to get the right information and make better choices.
Absolutely. So let's start with a very common scenario, and I'm sure you must be facing it in your practice every day. Patient walks in, and the patient is holding a celebrity photo, and they say, "Okay, this is the kind of look I'm expecting." So, how do you kick off a conversation in such scenarios?
Yes, Gunjan. So this happens sometimes, not all the time. So because patients are all the time scrolling on the social media, and people are obsessed with Bollywood and Hollywood. They watch these celebrities who look so good in movies, in shows, in cameras. So naturally, everybody wants to look good, and they are the benchmarks. So I acknowledge their desire. It's very human. It's very valid to look good, and then what I tell them, yes, let me see what is your desire and what you are looking at. So if I am doing an assessment also of them at the same time, and then I tell them, okay, like this is what you want, but look, this celebrity has this kind of a facial structure, and this is their skin type, this is their age, and this is their profession. And in your case, like your face shape is this kind, or your bony structure is in such a way, and before you aim for this particular look, there are certain things which are not in place. So suppose, for example, somebody wants lips like Angelina Jolie or Priyanka Chopra, but suppose if their face is sagging, or if they are having, like, very poor skin texture, no glow, then even if they do lips, it will look out of place. So we take them through the journey. So patient education, making them understand with empathy, and with, they should not think that I'm just brushing them off. So I need to acknowledge their desire, and then explain them that if it is possible, yes, why not? But if it is not possible, I will explain them that this is the reason. This cannot be achieved maybe right now. Maybe in your aesthetic journey, you will be eventually able to achieve it.
This is making that is making me more curious, Dr. Latika, over here. So when your patients are walking in, they have a lot of myths related to aesthetic treatments. So
Yeah.
how, as a practitioner, you are dealing with those myths? Maybe we can start at a broader level, and then I'll break it down in the
Right.
further
So
community.
mainly, like, definitely we can see in our practice that this patient needs a particular treatment, and but they have come with they have the desire also,
Mhm.
but then they will have certain objections because they have heard from their friends, they are viewing the social media, so they have formed an idea about these procedures. They have an opinion. So as a doctor, as an expert, we have to really dispel these myths without uh, kind of dismissing them. So we need to acknowledge them that yes, you have a fear, and yes, like, you have this idea about the fillers. So you can start off like this, like, okay, I understand your concern is valid, and if I were in your place and I was not properly informed, I would also think like this. But then you, as an expert, you have all the facts and figures, you have all the information, you know the aging process, you know how skin behaves, and with your training, with your expertise, you can definitely use aids like before after pictures, or you can use other visual aids some presentations, and then you can walk the patient through a journey. So I would always take like at least 30 to 45 minutes with the initial consultation, breaking the myths, because I think this is time consuming, but then at a later point, you save a lot of trouble. If the patient is educated, they're informed, and they're aligned with you, that's very important.
Absolutely. I think that makes a lot of sense.
Yeah.
Um, let's talk about social media also.
Yeah.
I think social media is contributing a lot to these myths. People are looking for drastic transformations, and there is a pressure somewhere to look good all the time, right? So, then in those situations, we are seeing a lot of young patients also walking in these days, at 25 years old, 20, and they're starting at the right time, I believe. So, how the counseling happens when it is about social media?
Right. So, see, social media is a boon also, but it's a bane also. So, depends how you are using it. If you are using it for educating patients, and you are using, honest and clear, transparent communication, not trying to sell or not trying to market yourself, but you are just using, a realistic communication, and which in a simple language which patients can understand, so definitely they will be you become your viewers, and they will follow your whatever you are telling them. But on the other hand, what I feel the doctors are facing is because they are so busy in their practice, so they don't have so much time to be on social media. And whereas on the other hand, the influencers, that's their job, so the whole day they are just researching these things, and they're talking about it. But the sad part is that they are not qualified for this. So definitely, if somebody is opening their social media, there are more chances that they will see the influencers rather than the doctors.
Absolutely.
So definitely, like, I would advise the doctors also to come forward and now start educating people. And I said in the beginning, like podcasts like these are a very good platform, to give authentic information.
I understand completely. A doctor's life is, anyways, so busy, and finding time for making those collaterals for
Yeah,
social
because that's
media.
not the primary work. The primary work is to, give results to the patients, to be academically sound, to, be updated, and to, be really practicing. So this, but this has, a way forward is like we have to balance everything.
Absolutely. So, now let's talk about a patient who is little aware, and the
Mm-hmm.
patient has done the homework well,
Right.
and the patient is saying, okay, doctor, I understand that I need ABCD treatments, let's say
Hmm.
a filler also, a toxin also, a thread also, but at the same time I will not go for these multi treatments. I
Hmm.
am more focused on this one treatment, but there is an expectation to achieve that result which could have been achieved with multi treatments. So, like, this is a little conflicting
Yes.
situation. You, as a doctor, how would you counsel over here?
Yes. So, in every consultation, my first consultation is the lengthiest, in which we address all these queries and concerns, and setting the patient expectation right. See, the first thing is the trust has to be built in the before any communication. The trust has to be there. So the trust is built by, if they see your certificates, they see your before after pictures, word of mouth. So they are already, when they come to your office, they should already have some kind of respect in your authority. So then they are in the listening mode. First of all, this is required. Otherwise, if they are seeing you just as a provider, they will just ask, okay, I want to do this, what's the price? I just want to get this done. Okay, your price is higher, I'll go to the next place. So this doesn't work. So first of all, you have to establish trust. Then you have to listen. You have to listen actively what the patient is saying. So it's not that we just dismiss them and we think we are the experts. Because ultimately we have to provide them satisfaction, not just the result from our point of view. So once you have understood the concerns, you validate it, whether it's a valid concern or not. If it is yes, you tell them, okay, this is possible, but because you have limited time and you want to get a good result and you want to do the least number of treatments, so this is the realistic result that we can provide you. The patient understands well and good, but suppose you feel that what they are asking is unjustified and it's really not possible, then you have to just tell them calmly, okay, let's understand. So you can take them their pictures, you can explain on their photographs that, see, this is all the issues you are facing, so this treatment can fix this. and this needs these many sessions or these many um, volume or whatever units, and then and it's a journey, that's another thing you tell them. We are not doing surgery that we can instantly cut everything and stitch and give you a perfect face. So it is a transformation, because your skin has aged, and the older you are, there are more changes which have occurred. We need to reverse those changes, and skin is a living organ. We need to respect the immunity of the skin. We need to respect the metabolic processes, the biology of the skin. So we cannot be very harsh, especially with our Indian skin type. It reacts so much with respect to heat or any aggressive treatments. It can react with PIH. So when you explain to the patient, and gradually you take time, you explain them, and they can see that yes, you are well versed with the treatments, you know everything, and you're explaining them well, and at the same time you're validating their concern also. So, and with examples, with before after pictures of other patients, then you can take them through this process and
I
make them
think,
understand.
yeah, very, very important points that doctors are just not providers. That's very important. And
Yeah.
building your authority
Yes.
in terms of your knowledge and
Yeah.
academics is very
Yes.
important.
Very important. Yeah.
Okay. I'm moving my conversation to a patient who's walking into an aesthetic clinic for the
Mm-hmm.
first time.
Yes.
And patient is probably that innate desire is there to look gorgeous and find a validation somewhere. Because when you're walking out, you want people to tell you,
Hmm.
okay, what have you got done? And but maybe you're not comfortable sharing, but you know that this thing is working.
Mm-hmm.
So, but they're not able to communicate it to you.
Hmm.
So then I think counseling becomes even more critical. So
Absolutely.
how do you pull out that innate desire from the patient so that that expectation is met from their perspective?
Yes. So, Gunjan, I try to understand the patient. Obviously, I know their age,
Mm.
and then I try to understand, like by talking to them,
Mm.
what is their profession, what's the timeline they're looking at, and subtly, I may also understand their budget. So, based on their budget, then
Yes.
we can align them.
Mm.
So now they want to really look gorgeous, but at the same time, they don't want anybody to know. This is what I've seen in my practice. They don't want anybody to know that they have done some
Mm.
cosmetic treatment. So they are okay admitting that yes, they are doing some facials or photo facials, but nobody wants to talk about that they have done some injectables or some lifts and all that. Again, before after pictures help quite a lot. So you show them, you know, consented photographs which have seen the realistic change, and then they can see yes, this patient looks natural, they look nice, and they don't look overdone. So gradually, then they get the confidence. And I always tell them that take baby steps, take small steps. There's no need to do everything all at once. And once they do a little bit, they get a little confidence, then they get a better understanding of what you are trying to tell them. Because if I'm talking about maybe laser for scars, so they have this idea that with this laser maybe my scars will disappear. But then if I tell them you will get like 50 to 60% improvement or 70% improvement, then actually they can't visualize how what is 70%. Once they do 2 3 treatments, and then you handhold them, you tell them, see now with the before after pictures you have improved, so this is like a 10% 20% improvement. So then they can better understand it. Yes, so that's how we have to counsel them.
Yeah. Let's also talk about safety of
Yes, very
procedures.
important.
Very
Yes.
important, and these are medical procedures which need to be done by medical experts.
Yeah.
Um, so, how to what depths do you go telling about the potential risks?
Mm.
Because we don't have to intimidate them. Also,
Yes.
you have to give them some comfort that I'm there for you and as an expert. But this procedure involves these risks.
Yeah.
So, to what extent do you go when you communicate these to your patients?
Yeah. So, see, once they have the trust in you, and then you are telling them about the procedure, you walk them through the procedure, the steps, the before precautions, after precautions, and then, yes, we touch upon the possible complications. So, they do ask us also upfront, is there any risk? So, we tell them, see, in most of the cases, majority of the cases, 95%, 98%, there is no risk. There would be like initial side effects which are part of the treatment, like bruising, swelling, or any lumpiness, or kind of some kind of edema or swollen eyes or something like that. But that's part of the treatment, so that we don't count as a complication really. That is a self resolving problem. So complication would be again, something which we don't want to happen, but since it's a medical procedure and everybody reacts differently, so there is a very minor risk of complication, and we provide them the incidence also, like it's a 0.1% risk, or point 0.2, like 0.5% risk, or 2% risk, so whatever is the quoted risk. And but then you tell them, see, you fly, there is always a risk of a plane crash,
Right.
but do you stop flying? You just trust the airline, you choose a good airline, and you make sure that all the safety checks, the airline is taking care of that. So same way, you have to choose the provider correctly, so who is experienced, who can, if god forbid any complication occurs, so they are trained to handle that also. So and most of the complications, when we learn any aesthetic procedure, we are well trained in anatomy, the right techniques, how to avoid complications, and if any complication occurs, how to handle it also. So once you are having all that information, then the patient is definitely more likely to trust you. And sometimes we, in my 25 years of practice, definitely I have encountered complications. And but we have been able to solve it. And at in my younger days, when I was not very kind of confident to handle these complications, I have taken the help of my seniors, I have taken the help of peer group, so patient has been handholded and everything worked out well in the end. So we have to inform our patients, but we have to also give them the trust that the factors which lead to complications, we are taking care of them. Like, I have the knowledge, I have the experience. If any complication occurs, we and the incidence of complications in our practice has been very, very minimal. So we've treated thousands of patients, but maybe two or three, four complications have occurred, and they also we have solved. So that's how we explain to
Right. I
patients.
think having your own set of experts with you and be connected with your
Yeah.
seniors in the
Yes.
industry, I think that it
Seniors and doctors from other professions like
right.
plastic surgeons,
Hmm.
ophthalmologists, anesthetists. So it gives a good, support system.
Absolutely. Now moving towards a little more intense expectation management. So we are talking about a patient who has scars, like you also
Mm-hmm.
pointed, and we know scars do not fade away in one sitting or two sittings. It's a journey. We all understand. So how do you keep your patients patient in such a situation?
Yeah, yeah. That's the art you have to learn.
It is acquired
Yeah,
with experience, I
because
believe.
yeah, with experience, because they are called patients, but they are the most impatient. So yes, so see again, kind of informing them beforehand. So you tell them that this is a procedure and this takes time, and our skin makes collagen process is taking this much time. Or if you're doing any hair treatments, like hair growth has a cycle, so once they know, understand that yes, it takes time, and this much percentage improvement will take in one sitting, so they patiently, definitely they do wait. And then you can keep them engaged, like when they are due for their next session, you can send them a reminder, you can check how they're doing, and then you can tell them if they have any concerns. Okay, I'm not seeing any result. So if you are in touch with them, you're engaging with them, you can just assure them that that's pretty normal. So it's just been 2 months, and maybe in another month or two, the collagen production would have stabilized, you will start seeing improvement, and we will do close up pictures, we will show you the results. So the patient is kind of reassured. Otherwise, if you're not in touch with the patient on their own, they may just think that okay, I'm not seeing any results, let me just quit. So you lose the patient. So you have to keep them engaged, you have to keep assuring them. So pictures help quite a lot, and explanation helps quite a lot. And then once they see their progress, even if it's a little bit after 2 3 treatments, then definitely they can patiently wait for the full improvement.
Patient engagement is a
Engagement is very
very
important. Yeah.
important. Absolutely. Let's now also try to understand that there is a very big concern about looking overfilled, pillow faces, and we understand that patients don't want that look, especially
Hmm.
Indian set of population. But at the same time, you have a desire that you want to look better version of yourself. There is a very thin line over here, that somewhere you are trying to achieve a drastic transformation, but at the same time you don't want to look overfilled or a
Yeah.
pillow face. So I think that will be a little challenging from a practitioner's viewpoint, because the patient is going back and they say, okay, there was no buzz about my changes. So do you get such questions or such
All
patients?
the time, all the time.
Okay.
Yeah.
Okay.
So on one hand, people don't want to kind of let other people know, yet they want
Right.
to look good. But on the other hand, we do get patients who want other people to see that they've done something. They
Hmm.
want dramatic results. So
Hmm.
we get all spectrum.
Hmm.
So see, again, patients are not the experts. So as a doctor, as an injector, we are the experts. So we have to kind of gradually align them and make them see from our viewpoint. So you acknowledge their desire, acknowledge their needs, and then you walk them through, like, this is what is required in your case, and this is what we have to do, and this is how you will get the result. So the phenomenon of pillow faces, sadly it has happened, so again I would just say that the experience, the training, all that matters. And again, we also have to have a firm ground for ourselves. If the patient is demanding more, we should know when to say no, because they will say, okay, this particular wrinkle also I want to improve, but if you see that by injecting this amount more, the patient is like going to fluff up and they're going to look puffy, you have to say no. So you have to tell them that, sometimes as injectors we are scared of losing the patient. If I don't do it, somebody else will do it and lose the patient. But if the patient sees that what is the purpose behind why you are saying no, then they will understand. So here also comes the role of combination treatment. Not everything you have to do with the filler. You need to combine your toxins, you need to combine frequency devices, ultrasonic devices, you have to use thread lift. So whatever indication, whatever is the concern, you have to just take the patient face as a whole, and then you see that what is the technology, what is the treatment that will give the optimum result for this, not just because you have a particular treatment and you just want to do that. So you have to, optimize yourself also, and you have to communicate it to the patient also that if we do this, it will not look good. Rather, it's better either we wait for some time, or if you don't accept it, then we can go for another type of treatment which will not volumize you further, but it can improve from this perspective.
Right. And that makes a lot of sense.
Yeah.
So, also, I want to touch upon this topic of budget for the patient.
Mm-hmm.
Aesthetic treatments are expensive. We
Yeah.
all know that, because we are sourcing the right product from the right channels. There, somewhere, is there a need to justify these treatments for the patient as a practitioner for you?
Yeah, so see, I do understand the budget concerns of the patient, and I do like to keep it realistic. So, what normally I will make a plan for a patient, like let's break it down into sessions.
Okay.
So, or if they want to kind of club up the whole package, so they can get discounts on that. Like if they have, upfront payment, definitely it makes it cheaper for them. But and then there are EMI options also are there. So that way we do try to help the patient, so it makes it easier for the patient to spend on these treatments. But on the other hand, I also see patients who have no budget problems, like they can easily spend, but somewhere in their mind they have this thing that, okay, it's expensive. So I do see them, they do spend on travel or expensive clothes, branded clothes, jewelry, handbag, but they are not ready to spend on the treatment. So then somewhere you have to explain to them the value of these treatments, the value this is adding to their life. See, you could do with one or two bags less, you could do with like a pair of earrings less, but the confidence that you get with these treatments, the brightness they provide to your skin, the confidence boost, how your life changes because of this treatment. So once you can make your patient understand this concept, then patients are ready to spend. It's not that they don't have the money. Sometimes they do have the budget, but it's just that it's the mindset that needs to be opened up, that how this is more valuable to them than something which is like they're holding it like accessories, but this is like their own persona, their own beauty, which will add much more value to their life. So this is how we do it.
Yeah. I think we have discussed and touched almost all the topics on managing patient expectation. I will like to close the session with one question. Um, you have, I understand that all the practitioners are different. This kind of clients which are working are also different. But would you like to tell our audience over here that some significant steps in the counseling cannot be missed out? So some kind of guideline which can, help our audience over
Yeah. So I think, Gunjan, this is the most important question, your closing question,
here.
because first, whenever you have a patient walking in your clinic, don't see them as a customer. See them as somebody who to whom you can add value. So you can add value to their life. So the care principle comes first of all. So if you care for the patient, you care how they look, and if you think that you were in their place, what kind of treatment you would like to do, and how would your expectation be, what kind of expectation you have from the doctor. So you need to provide that. So you need to provide your ambience, your staff, everybody has to support in the patient's journey. And then of course we talked about trust. So you need to have your credentials in place, you should have your certificates placed prominently, if you have written any books or papers. So your ambience should talk about it, maybe your social media handles. So your authority needs to be really built. And then when the patient comes, always schedule a little detailed consultation at the first go. That will really save you trouble, any potential trouble in the future. Because once you win over the patient's trust, and once they're aligned with you, believe me, the journey really gets smooth. Technical skills you can learn, all the new procedures, you can buy all the gadgets, but this is one thing, earning the patient's trust. And god forbid, even if there's a little complication, if you have the patient's trust in you, believe me, they will not really and get annoyed with you. They will understand that you have done your best, and this is part of the treatment, so it will really save you a lot of trouble. And then being realistic about aligning them with the realistic results, what is possible, what is not possible, learning when to say no, and optimally combining the treatments for the patient's benefit. And showing them the results, before after pictures, validating their concerns, and then a lot of hand holding even after the procedure has been done. So getting a follow up done, and then seeing if they're doing okay, if they need any touch ups, and if they are, you should be available for any queries if they have after the procedure. A good before after procedure care should be provided to them. So once the patient feels comforted by all this, there's an open communication, there is trust, and you are doing your best, you have the patient's expectation aligned with you, and they're realistic. So this journey really becomes smooth, it's a win-win for all. And I think this is where we need to all head to, so which I call as mindful aesthetics. We should not be just commercializing the whole thing, because ultimately this will bring a bad name to aesthetics, and in the long run it will be harmful for all the aesthetic providers. So in the interest of everybody, we need to be mindful, we need to have an honest approach, and doing the right thing, and keeping the patients hand in hand with us. And that's all I would say to you. Thanks.
Thank you so much, Dr. Latika, for sharing your extensive insights on this topic. And
Thank you.
and our audience over here, if you have liked this podcast, please subscribe our channel so that you can be updated with our future podcast. Till then, keep innovating in your practice. Thank you so much.